Welcome to Mind Your Mental Health channel, a channel for mental health awareness, psychological health and well-being. In this episode, we are going to talk about psychosomatic disorder. It's a wide range of disorder. As the name suggests, we are talking about psychological and somatic. Somatic means bodily. So we are talking about the mind and the body. So disorder caused by the interaction of mind and body, or bordering on the area of mind and body together. So mind cannot exist without a body. Body cannot exist without a mind. So both needs to work together and complement each other, support each other to lead a very healthy, holistic life. When I say health, I'm talking about physical health and mental health. So that's what this psycho and soma. So we are going to see today how this affects and induces or causes psychosomatic disorders. So before going on to the disorder by itself, let me explain about the psych and soma, our body and mind. We have done number of episodes on basic understanding about the mind. Now first about 12 or 14 episodes is on mind, different aspects of the mind. So and in those episodes, I've also talked about nervous system, brain, nervous system, all those things, and you'll be able to understand this particular episode more when you visit those episodes. So if you have time, please do visit those episodes and then try to understand the psychosomatic disorder. So let me first talk about the body, very briefly about the body which is relevant to the mind. Then I'll talk about mind and then we'll see the connection. When we are talking about mind, we are talking also about the brain, because you can't separate mind from the brain, because certain functions of the brain is collectively called as a mind. So that means we need to know brain and nervous system. Nervous system is a broad terminology which includes everything, nerves and brain, everything. So we have brain, we have spinal cord, and we have nerves. This is how the brain is structured. I'm giving you a very basic outline, not the deep core knowledge. So brain is in the skull, inside the skull, and it sends out a thick nerve which is called spinal cord. From there, number of nerves branch and then go to all over the body, all the parts of the body. It is almost like wiring in the house. So we have electricity produced somewhere which is passed through cable and which enters our house through a wire, electrical wire, and then there are a number of wires all around the house connecting to switches and other equipments or appliances, and the current passes through from the place it was produced and then through the cable, through the wire to the appliances, and the appliances work. So that is a simple kind of explanation about nervous system. So we have brain, we have spinal cord, we have nervous system. In the brain, we have different parts, but I am going to confine to one particular lobe or a part of the brain which is called limbic system. It's also called emotional brain. It manages our fear, many other mind related activities. It has a number of components, a number of parts within itself. One is called amygdala, other one is called hippocampus. There are a number of parts like that. So that constitutes, that's almost the center of the brain, that constitutes what we call as the emotional brain or limbic system. This limbic system is also connected to the nerves which is going to the body. So the nerves which is distributed throughout the body, we can broadly classify them into two categories, broad categories. One is autonomic nervous system, other one is somatic nerves. The somatic nerves are the nerves which is connected to the muscles and the tendons, which activates the muscles and tendons. If I am walking, it is because of the somatic nerves. If I'm raising my hand, it is because of the somatic nerve. The command, the energy starts from the brain, comes down the spinal cord through my neck and then to the shoulder, and then the muscles in the shoulder activated through the nerve impulse, and then I lift my hand. So that's how the somatic nerve works. There is another important nervous system called autonomic nervous system. As the name says, is autonomic. It is not under the direct control of our will. I can't control it. Brain directly controls it. The power center is in the brain, and that is closely related to the limbic system. Hypothalamus is one of the part of the limbic system, and it is also part of the autonomic system. So the autonomic system, what do they do? Where do they go? What the nerve supply? So they innervate, or the nerves go to some of the vital organs, heart, lung, stomach, kidney. All those parts are supplied or connected through autonomic nervous system. That's why I cannot willfully control my heart. I cannot say today, this morning, oh, it's a nice day, I want to increase my heart rate today. Now let's go on, double the speed. I can't do that because my autonomic nervous system and my limbic system control those things. So autonomic system is not under our direct control, unlike my muscle. This is under direct control. So this is the system which controls, or which connect many of the important parts in the body, within the body. So we have seen the brain, we have talked about the brain and the limbic system, and the two nervous system, one is somatic, one is autonomic system. Autonomic system is the one which is totally autonomous, not under our control. It is controlled or influenced by limbic system. It is, in a way, it is influenced by nervous system. Okay, so we have talked about the brain and the nervous system. So the command which starts here comes through my spinal cord and then branches out to the nerve which is supplying my shoulder muscle and then activates. The impulse is usually electrical. It comes and ends in a synapse. So neuron and synapse. This is the kind of a junction in which electrical impulses transform into neurochemical impulses. That's where the neurotransmitters involved. I have talked about in detail in one of the episodes. Okay, so this is how the nerve signals or impulses passes. Electrical going on to electrochemical, neurotransmitters. Those are brain chemicals which kind of transmit messages and activate things. In addition to that, there is another system called endocrine system. Endocrine, basically there are glands in the body. Thyroid is a gland, all of us know. Like that, we have number of glands. These glands secrete hormones. These hormones also bring about changes in the body, which is also not directly under our control. I can't increase or decrease thyroid hormone level willfully. It is all under the control of autonomous nervous system or the endocrine system. So there are a number of hormone producing glands. These are hypothalamus, pituitary gland and pineal body, and thyroid. We all know within the thyroid there is another gland called parathyroid gland. Then we have thymus, we have pancreas, which is kind of involved in diabetes and other problems, and adrenal, and the gonad. Gonad, when we say gonad, we are talking about sexual glands. And in a woman it is the ovary, in a man it is the testis. So these are all the glands, they belong to endocrine system. So all these functions mediate everything in our body. Okay, and psychologically also these systems are involved. So I am going to kind of give you an example. Now, so my heart rate is at between 70 and 80. That is a normal range. 72, 70 and 80. That is a normal range. Suddenly, I see something which is very dangerous. Let's say a snake, a poisonous snake. The very moment I look at the snake, My information in the brain tells me I am seeing a very poisonous snake. If I don't manage the situation, I'm going to die. It might bite me. So that induces a lot of anxiety in me. That fear comes in. Fear is one of the defense mechanisms. Very important to get away from that dangerous situation. And that fear is originating from the limbic system through the autonomic system. It activates all the autonomic system. So one of the nerve which goes to the heart activates, and heart goes faster. This is done automatically. I don't think that, okay, I have seen the snake, so let my heart goes faster and pump blood so that all the chemicals travel faster. I'm able to act faster. I need not do that. So automatically that kicks in. That is devil. So that's where all our systems gear up for the danger. So that is how the soma and psych work together. That is in a normal situation. When the same system acts without any problem, then it becomes abnormal. Without seeing a snake or without having any danger around me, my heart goes faster. Then I perceive the heart rate, heart beating, then it becomes a palpitation. My heart rate goes up. It goes up to 120, 130. And my skin reacts, autonomic reaction, reacts, and then I develop sweat, perspiration. All those things, signs and symptoms of anxiety and fear. But if I get that without any reason for that, then it becomes abnormal. So that is very simply explaining about the psych and soma. So next we'll talk about why do people develop psychosomatic disorders. There are different reasons. One is genetics. Many of the psychiatric disorders, we do talk about genetics, but genetics is only part of the problem. It is not that gene will transmit that disease into all the children. So they only inherit the propensity. And another important reason for psychosomatic disorders is stress. Stress could be acute stress, it could be continuous, chronic stress, especially chronic stress, from which you are not able to get out. Then that can induce a lot of physical health problems. The same way what I explained, the autonomic system gets working and they works excessively and then produce all the problems. So stress is another important cause for psychosomatic disorder. Some physical conditions can also lead to psychosomatic disorder. Chronic physical condition itself is a stress. Chronic arthritic pain, those things can itself cause stress, then lead to psychosomatic disorder. Certain physical disorders are also classified under psychosomatic disorders. And developmental causes, the childhood trauma, childhood stress, childhood problems can lead to psychosomatic disorder in the later age. Social factors, chronic problems, chronic poverty, can induce some psychological problem. So psychosomatic disorder in a way is the expression of what we are going through in an adverse way. Instead of developing a depression or anxiety as a psychological disorder, I can also develop bodily problems like eczema, asthma. These are all classified as a psychosomatic disorder. How common it is? It occurs about 5% of the population. So 5 to 7% of the population can have some form of psychosomatic disorder. And some of the research, some of the studies have shown that women have more psychosomatic disorders than the men. Some of the studies even point out that the psychosomatic pain disorder, what we call psychogenic pain disorder, is much higher in women compared to men. Some of the studies say it's 10 times more in women than in men. One of the associated or causal problem is what we call it as alexithymia, where person is not able to express the emotions. Now, they might feel very tense, very anxious, but it could be cultural, it could be educational, their level of understanding things. They might think that the emotions I need not discuss. When I go to a GP, I need to talk only about my physical problem. GP is for aches and pains. or some physical problem. Now, I don't think I should talk about my emotional problem. I'm going through a domestic problem, which I don't think I should be discussing with the GP. That situation is changing now. People are more expressive now. But there is a concept called alexithymia, where they are not able to express their emotion. This bottled up emotion, which has not been expressed to others mean to close related people or a friend, close friend, we don't express anything, we bottle up, then that can lead to psychosomatic disorder. And childhood neglect, as I said, childhood trauma, neglect can lead to child problem. And sexual abuse can lead to later on psychosomatic problems. So some of the sexual abuse they are not able to discuss, bottled up within the mind, which kind of boils and then comes out as a psychosomatic disorder. And alcohol and drug can be associated problem for a psychosomatic disorder. Because of the psychosomatic disorder, they can take on to alcohol, drug as a relief. And chaotic lifestyle can cause a psychosomatic disorder. Chaotic lifestyle which induces a lot of stress and a lot of unhealthy behavior can lead to psychosomatic disorder. And one of the findings is chronic unemployment can also lead to this kind of a problem. So we have talked about the causes and prevalence, all those things. What are these psychosomatic disorders, and what are the disorders we call it as a psychosomatic disorder? Under psychological classification, there is a condition called somatization disorder, and there is a condition called conversion disorder. Conversion disorder, which I discussed earlier, the neurological disorder, where hysterical conversion disorder, that is also, we can call it under psychosomatic disorder. And pain disorder, psychogenic pain disorder, and hypochondriasis. Hypochondriasis is a situation where patient presents with number of symptoms without any physical cause. So they might come out with a number of symptoms, and with the internet and web, the information available, they might self-diagnose themselves, and then they might say, this is what I'm suffering from, and number of tests, GP might say, I've done all the tests, nothing wrong, you don't have any real bodily problem. They might say no. They might change the GP. They may go to somebody else. And GP might refer to neurology. Neurologist will examine, do everything, and then say there is no neurological problem. Then you say this doctor hasn't been trained properly, so let's go to somebody senior, or let's go to somebody authority in that area, then I'll check it up again. They won't mind going through a number of investigation, even invasive investigation. They don't mind going through that. That is a kind of a disorder what we call as a hypochondriasis. Okay, and we can also look at the bodily problems, bodily psychosomatic problems, and classify them according to the system. Now, heart and related symptom, what we call cardiovascular symptom. Now, blood pressure can be a psychosomatic. Now, we don't kind of say blood pressure is a psychosomatic, but the psychosomatic, the concept can be used for blood pressure, high blood pressure basically. Hypertension, what we call it hypertension, could be due to psychosomatic reason. Chronic stress, anxiety, anger can lead to increased blood pressure. That can turn into a hypertension. And the chronic stress can also cause arrhythmias. Now, so non-specific arrhythmias can be due to stress or psychological reason. Angina is a chest pain. Angina can be due to heart condition, or they can also be due to chronic stress affecting the heart and manifesting as an angina. And in the digestive system, indigestion can be due to stress and psychological problem. There is a condition called irritable bowel syndrome that is known to have caused by psychological factors. And acid peptic disease, ulcer, the peptic ulcer, we know. Now your gastroenterologist or your GP might tell you, okay, take this medication for your ulcer, but you need to change your lifestyle. You need to be calm down, relax. Don't kind of be all the time edgy and all the time trying to achieve something. So you need to relax. You need to give a space for yourself. So that kind of a lifestyle can cause a disorder, which could be peptic ulcer or acid peptic disease. And we say type A personality. I'll talk about that when we talk about personality disorder. So type A personality basically want to achieve many things, restless, always on the go. They are more prone to develop these kind of psychosomatic disorders. And then we come to endocrine system, now where I talked about glands. Now so in the endocrine, the weight loss and weight gain could be due to stress. Now stress can also induce weight gain and weight loss, and decreased appetite can also be a part of psychosomatic manifestation. And dysmenorrhea in women can be due to stressful factors. Now psychological factors can contribute to dysmenorrhea. Now patient has a dysmenorrhea, very painful menstrual cycle. They might go to a gynecologist do all the tests and then do everything, and they say there is no kind of a real bodily problem. So they might even say that it might be due to tension. Now, so whenever there is a high tension, people can develop dysmenorrhea. So in a susceptible individual, not everybody, in a susceptible individual, they can develop dysmenorrhea. So that could be called as a psychosomatic form. Fibromyalgia. Now there is a chronic pain syndrome. Now that could be a psychosomatic manifestation. A disorder which manifests due to psychosomatic reason. These are some of the psychosomatic disorders we come across in our day-to-day. In a skin disorder, eczema can be exacerbated by stress. Now we all know asthma and eczema. Now people who have experienced this, they can always realize that, okay, whenever I'm going through stress, it could be work-related stress, it could be any stress, domestic stress, can manifest in a flaring up of the eczematous lesion. So when they are totally relaxed, contented, and everything goes smooth, their skin reactions are lesser. They may not have a florid eczematic reaction. When they go through a lot of stress, this flares up. In psoriasis also, people have a psoriatic skin condition. It worsens during the stressful period. So many of the physical disorders can have a psychosomatic component to that. Okay, so next we come to what is treatment. Treatment. Psychological therapy is a mainstay. We can use some medication. So in psychological therapy, we talk about cognitive behavior therapy, which is an excellent treatment for many psychiatric disorders and also for psychosomatic disorders. We can have counseling. Mindfulness therapy is another very important therapy which helps in a day-to-day life to manage stress and all the problems of our day-to-day life. Now and psychoeducation, understanding the psychosomatic aspect of it. What happens is the moment we say patient comes to me with a lot of headache, I am a GP, I explain everything, I do all the tests, all the investigation done, nothing is positive, everything is negative. Then I start the subject of psychological. It could be psychological. Now, the moment the GP says it could be psychological, it can elicit two kinds of response. One is relief from the patient. Oh yeah, it could be, I understand now. Yeah, now that you say that, these are the problem which I'm facing now. This is a chronic problem at home and workplace and this stress. Then they might be relieved that there's a solution. Now we know all the tests are negative, but till I know there is a problem where I need to address. Another reaction will be, I'm stable, I'm not mentally ill. Now, why are you sending me to a mental health services? Such stigma, we have improved vastly as far as the managing the stigma, mental health stigma, but still there in the society. Now, it also depends on different factors. Now, it could be culturally also. The person might say that, no, I don't think I have a mental illness. They might think the mental illness is a weakness, or mental something which they'll never get. So that kind of a reaction can block the help he needs. So we need to understand psychosomatic disorder in the proper perspective, then we will be able to seek help. In this episode, we talked about psychosomatic disorder. In our next episode, we will discuss about obsessive compulsive disorder, or in a short form, it is known as OCD. We will discuss about the clinical presentation and the treatment and other related concepts of OCD. Thank you for being with us. Please do subscribe our channel to get more information about future episodes and future activities also. If you think this channel is helpful, please do share it with others. And if you have any comments, please do make your comments. See you at the next episode. Thank you. Bye.